All right, well, it is 12:01. We will get started again. My name is Thomas. I'm the director of the Alaska After School Network with Alaska Children's Trust. Welcome to our call today with the Department of Health and Social Services regarding summer COVID-19 updates for Alaska camp operators and highlights from the field. First off, I want to start off by saying a huge, tremendous thank you to everyone who's joining the call, for the state of Alaska, for their partnership throughout the pandemic. Really to help keep our field informed and motivated, engaged, and keeping kids safe and our staff safe this summer. Thank you to all the providers who joined us too. We know we have a lot on our plates this summer again. It is amazing that a year ago we were just in the process of struggling to open programs, and here we are now really with a robust summer season ahead of us and in the midst of. So thank you all for your work. During today's call, just a couple statewide call agreements. We want to make sure that we keep our comments, questions, and concerns concise, be solution oriented, share equity and voice, make sure we're staying youth focused. Remember, we're all in this together. Kindness matters. There may be at times that we have a disagreement on some of the recommendations. Again, coming from this in this place of we are really looking out for the best of our collective communities. And please keep yourself on mute when you're not speaking to reduce feedback. We will have a couple opportunities where we're going to encourage you to give your questions and comments so that we can ask our specialists those questions. What we're also going to really encourage you to do, please go ahead and use the chat feature as well. We'll be monitoring that. Peely from our team is going to put a sign-in sheet as well in there, so we just are able to collect who's attended. The call is being recorded today for those who are not able to attend, because we recognize 12 o'clock is lunchtime in most camp programs. So we'll be sharing this out widely from there. Towards the end of our call, we also asked a special guest from the Rasmussen Foundation to come onto the call and share about their summer camps initiative, where they're helping support summer programs financially during this season to make sure that we're still engaging kids. Without further ado, the first thing I would like to do is pull up our data dashboard for COVID-19. So the state of Alaska has done a phenomenal job of really helping to keep our public information and data open and available and accessible via the state's webpage. What we're going to always encourage you to do is check back to the state resources, check back to your local guidance as well. What we are going to be sharing on the call today is based off of the May 28th CDC guidance for summer camps. We know that there are more stricter guidances in some communities, especially regarding municipal requirements or potentially a tribal requirement as well. So always adhere to what is your local guidance as well. For the call, though, what I'm going to ask is, Joe, do you have any kind of quick updates in regards to the status of COVID-19 in Alaska? We've been making some, I will say, negative, positive progress. We're getting more people negative.
That's a good way of putting it, Thomas. Thank you so much, and really appreciate the opportunity to be with you all today. It looks like we've got about 25 participants today. What I want to do is primarily just be available for questions for folks. But, you know, generally our case counts have really gone down tremendously. I'm sure folks have been looking at the epidemic curve. And if I can share my screen, let me see if I can do that. Oh, if you can give me the ability to share screen, I'll show you a couple of graphs and just take you through what's happening statewide, just so you have a sense for that. Okay, let's see here.
Yeah, we'll get your co-host.
Oh, there we go. All right. So you can see this is the dashboard. And I'll call your attention first to the epidemic curve at the bottom. This is cases by report date. And you can see what's happening here is that our case counts are just really going down dramatically. And that's what's happening nationally as well. Can you hear me okay, Thomas?
Yes,
yeah,
I'm being excited.
Yes. No, it's super exciting. And then here is our alert level map for Alaska. You know, we're going to see some variability from yellow to orange to red. In general, everything is trending down. But you can see that these areas here that are in the orange, they're generally a little bit more sparsely populated areas of Alaska. But hopefully soon we'll see all of these areas go into the yellow. And if you can see southeast, I can maybe blow that up a little bit. Here's southern southeast still in the red. Canton has experienced quite a lot of cases, and some of the other communities down there. But and here's Juneau here, but everything else is in the yellow, and Anchorage is in the yellow, and Fairbanks is in the yellow. So this is really good news. On the national front, I was on a CDC call earlier this week, and basically it's looking pretty much the same. It's very exciting news. The big thing that we're trying to do is get as many people vaccinated as we possibly can, of course. And that is going to take quite a lot of effort. You know, what we're seeing is that initially there was a big bolus of people who wanted to get vaccinated and did get vaccinated quite quickly. And then it peaked and then it started falling off. Now what we're starting to see is, although our trends are continuing, you know, as time goes on, more people are getting vaccinated. The change in the proportion of eligible people who have been vaccinated is much smaller. So you're talking maybe a percentage point every few days. And so what we're really trying to do is get the word out so that people understand not only the safety and efficacy of these vaccines, but also understand the implications of not getting vaccinated. One of the things that people may not have a really good sense for is the implications of long COVID or long-term effects of COVID if you get COVID infection. Even mild infection, and in some cases it looks like through some of the epidemiologic studies that have been done, even people who have asymptomatic infection could be at risk for long-term consequences, one of which is stroke in young adults. And so that's one of the things we really want to get across to folks is that even though they may be in a low risk category for serious COVID disease like hospitalization, ICU stay, they may not like the long-term consequences that come along with COVID, even mild infection. So that's what we're really trying to do. So Thomas, I think that's sort of the big picture perspective on where we're at in terms of vaccination coverage in Alaska. We're roughly about 10 percentage points below the national average. And so we do have a lot of work to do to catch up. And so that's really what we're trying to do. And certainly when it comes to kids, you know, we are so thankful now that we have vaccine that goes down into late adolescent, you know, sort of that late adolescent group. And the teenage group. And as time goes on, and Dr. Pullman Cutchins is going to be joining us as well. He's one of our staff pharmacists. He can talk a little bit about predictions for when we'll see even younger kids be eligible for vaccination. So maybe I'll just stop there in the interest of time and open it up for questions that folks might have. And we can stay on and answer questions throughout. So whatever works for folks.
Thank you.
Now might maybe be a good chance actually, and I want to also welcome Dr. Zink, our Chief Medical Officer, onto the call as well. Dr. Coleman, if maybe we can share out some of that information just in case you need to duck off the call earlier, we can do that, and then we'll roll into a little bit more in regards to what the CDC update was for camps. We'll talk about both day camps and overnight camps, some of the differences there. We'll get a chance also then as well to hear from one of our providers, Trailside Discovery, that's been doing a really great job with mitigation. So if there is any kind of other updates in regards to where we're seeing potentially, hopefully on the horizon, vaccine available for kids under 12, it would be great to share that out.
Yeah, Coleman, do you want to take that one?
Yeah, thanks. So what we know about kids under 12, we know Pfizer and Moderna are both have ongoing trials right now that they're enrolling patients in, and they're studying these vaccines in kids all the way down to 6 months old. Those trials have not met enrollment, so we will get a better idea of time frame once the trials meet enrollment. That's the number of people they need to enroll based on their pretrial calculations. That said, when they meet enrollment, we're about 3 to 4 months out. We haven't met enrollment yet. We're hearing a lot on the national calls, you know, September, October. And I think that's a pretty accurate time frame. At this point, I can't see how it will happen before September, just given the fact that those trials are still enrolling. But we do expect either 6 months and up, or 6 and up, or 3 and up, somewhere in that window to be approved. We don't have any reason to think they won't be. Those trials took a little bit longer because with the 12 and ups, they studied the same dose that adults got. With the younger kids, they're looking at some lower doses. So that's where we think. We think not until September, October. But then I think it's important for everyone to remember, even if they get approved, then it takes kids 5-6 weeks after their first dose to be considered fully vaccinated with either Pfizer or Moderna in the 2-shot series. That's, if anyone has any other questions, I'd be happy to answer them.
Great, thank you. So we're gonna.
Thomas, this is Lisa Rabinowitz, one of the staff physicians with public health. I think what Coleman just mentioned is super important for camp planning for the summer, is that window to get kids fully vaccinated. So sending out, camp information materials early enough so kids can get motivated to get vaccinated before camp starts would be very important and key to your planning.
Great point. And we recognize this too. A lot of our providers have been up and running for the last several weeks. But an important part to acknowledge is that 12 is really that cusp for that 6th grade group there. And that is where a lot of, we know, our younger age programs or day camps are moving, that might be the last year that they're in a day camp program and moving on to another program. That's a great time again for us to do some advocacy, and we'll talk about some of that advocacy outreach that we can do towards families and how to set up and request a vaccination clinic potentially at your program. I'm gonna, for the sake of time, keep us moving through our slide deck here. Let me just pull that up, and I'm gonna ask Marina is going to be our presenter next. If I can get my slides to move. Let me see.
Hello, everyone. Thank you for joining for this meetings. It's a great opportunity for camps operators and publics ask direct questions, public health professionals, you get the answer and get latest updates. So I'm going very briefly review recent CDC updates for camp operators for this summer and touch up on cleaning, disinfectant, and provide a lot of resources, links, information that can be pasted on the chat box and you can review later. So would you like me, Thomas, would you like to share the screen?
Yes, I'm pulling that up right now for you.
Okay. So youth operators play very important roles in a children's life and development. So they provide new opportunities for kids to try new activities and to learn at the same times. So develop relationship, emotional and social skills. So even the summer camps are already running for a few weeks. Department of Health and Social Services would like still recommend to review new updates for the youth operators, for youth summer camp operators, and answer some questions.
And Marina, I'm going to stop you there. My computer, the PowerPoint seems to be frozen, so if you want to pull up, that'd be great. That's why we do a double backup.
Yeah.
Oh, this is Carol. I can pull it up as well. So.
Super. Thank you, Carol.
Just a second. Is Carol doing now?
How's that looking?
Yeah. Okay. Wonderful. Yeah. Thank you. So on May 28, 2021, CDC issued updates on the guidance for youth operators, for youth camps, and that basically guidance designed for all type of summer camps, for day and overnight camps. So, and guidance is designed to supplement and not to replace any federal, state, and local territorial public health safety rules and regulations. So guidance outlines strategies that camp operators can use to prevent spreading the COVID, basically prepare for someone who gets sick, how to handle it, and keep healthy operation in safe environment. So for the next slide, generally, we would like to remind that generally children's less likely to get severe sick from COVID. However, they can still get sick, and usually they have mild and mild to moderate symptoms level of disease, but sometimes they can be asymptomatic. So they have no symptoms. However, they can still spread the virus and share the virus with family members and staff. So for that reason, we recommend for each camp to review their plan. That plan should be developed in collaboration with local licensing organizations, state and health departments, and each plan should have certain steps that including how to address if someone get exposed to COVID or get sick with COVID. Basically, a plan should be prepared for an outbreak. And it's important that every plan has include modified activities for not fully vaccinated children. Please, next one. So for fully vaccinated, not fully vaccinated. So in the ideally, we would like to talk that camp operate with fully vaccinated children, participants, staffs. However, in the reality, it's not happening. Camps operating having participants with mixed health status and vaccination status. So sometimes it's unknown. So we ideally would be not requiring the mask and not social distancing and not frequent hand washing. However, the reality, we have a mixture of children and staff and family members. So we would still recommend to encourage staff and campers to wear the mask, apply preventive strategy like frequent hand washing, wearing the mask, especially for indoor activities, and help us to slow down the spread of COVID. So we recommend the camp operators encourage staff members and families as well to keep wearing the mask, especially indoors. Because since youth don't get to make a choice about vaccinations, so their parents do. So we encourage again operators be supportive of campers whose family have a kids not vaccinated or choose not to be vaccinated, or if they're too young to vaccinate it, because at this point, only children at age 12 and above are eligible for vaccination. Please slide next one. So CDC developed a lot of materials for the activities indoor and outdoor. So this is CDC get the infographics, some examples of indoor activities and compare for fully vaccinated and not fully vaccinated people. So we can see that mask is still required to wear for indoor activities. Please, next one. Yeah, all links will be copied in the chat box and all the resources you can review later at your convenience. So for some outdoor activities, the same thing. Is still recommended mask, and especially if kids cannot keep the social distancing for not fully vaccinated participants. And for the next slide, please. So we really encourage camps to promote vaccination, because vaccination is the leading and public health preventive strategy to help all this pandemic. And camps, of course, can really help to increase vaccination uptakes in the communities and the families. So by providing the educational materials, we provide a lot of resources, links, handouts, and materials for children and families about the vaccination. Also, camps can establish supportive policies and procedures to have a vaccination for any eligible adult and children at their facilities, and helping supporting staff to get vaccinated, take a time off to get the vaccine. And of course, we would really encourage for camp operators remind the families to get a regular vaccine, age appropriate, besides the COVID vaccine, because at this point, a lot of children are really behind on regular vaccines that are appropriate for the children certain age. So we help you reminded, please remind the families to get a vaccination update, especially before the school year starts. And so that is the slide shows you example for request to have an on-site mobile vaccination clinic. So we provide the resource links for that. Camp operators can request online. That's very simple form to fill out. Your organization, contact information, how many participants you think, or even host the community for community pop-up vaccination clinic. So that is couple forms, one form designed for summer camps that located within the municipality of Anchorage, another form is outside the municipality. So all links will be provided. And of course, vaccine is safe, effective, at no cost preventive measure, and help us, all of us, return to normal lifestyles. And we encourage camps to join us Sleeves Up for summer, community-driven campaign, and to increase vaccination rates in the statewide. So that is the main goal. And community immunity can be achieved by high vaccination rates and help us to protect all Alaskan and help keep us, Alaska keep running. So we need to do this together. Thank you. And next one. So that is example. Summer camps can request a presentation about vaccination with public health professionals, so that I can even do it from the phone. You have the code, or you can send email and you get a contact phone number. So you request the virtual, usually it's done virtually, informal Q&A session at your location, and everybody has opportunity to ask questions and make your own decision about the vaccinations. Very helpful resources. So it's usually runs about 20 minutes. And next slide, please. And personal education is the first steps in building education in our community and building the public trust and confidence. So CDC created a lot of hands-out materials, even videos on how to talk with family and friends about vaccination, how to interact with parents, hesitant parents about vaccination, how to address their concerns. So all resources, copies will be provided in the chat box. Very helpful information. And please, next one. And a little bit touch up on cleaning and disinfecting. So at least we're moving away from a lot of disinfectant per day. So I reviewed the CDC guidance, and we recommend the summer camp operators still review their plans and to determine following. So determine what do you need to be clean and how often to be clean and what to use soap and water or disinfectant. So to what need to be cleaned, CDC still recommend prioritize cleaning of high touch surfaces like tables, counters, doorknobs, pens and pencil, and etc. equipment. So regarding determine how often to be cleaned, so recommendations still to clean at least once a day with soap and water, and consider it maybe disinfecting after the cleaning on high touch surfaces and high traffic area, especially areas for young children when they occupy with young children, because kind of high interaction with surface and touching with mouth and etc. So in most situation, once a day cleaning with soap water recommended at this point, but it should be reviewed individually at the camp location and prioritizing high touch surfaces. And of course, camps operators should still consider using the personal protective equipment like a mask and gloves while cleaning and disinfecting performs, and keep mind and resources. And of course, would be helpful to review some EPA approved. So a lot of disinfectant solution right now in the stores and everywhere available. However, not all of them kills COVID. So the next slide please, you can show that. We will provide the links, how to clean, and these best practices, what the steps should be taken, and how to read EPA approved labels. So get some more information. Even they have a small video, very helpful short video, how to do that and how to learn about the labeling and what is the EPA approved. It's called N list. And next slide, please. For the resources, we'll paste that resources. How about talk vaccinations, about exactly designed toward parents and kids, and toolkits, hands out. So very will be helpful if we will be available in the summer camps to educate public. It will be very helpful. And for the next one, please. The next slide on getting more information. Yeah, just one more.
That's all I got.
Oh, really? Oh, okay. So again, more information, I will put the links again, the same, what I mentioned earlier regarding how to request presentation, how to get request on mobile cleaning. So all will be in the chat box for your convenience. You can review later. And you're welcome to ask questions later in the end of it. Thank you so much for your attention.
All right. Thank you, Marina. So we wanted to take a chance now to dive a little bit further into the guidance, and we're going to ask Vicki Longleather, who's the director of Trailside Discovery Camp, to share. But before we do that, wanted to actually pull your attention to a few parts in the guidance where we saw some changes happen in the guidance. So again, if you have not, we're encouraging you, look at the CDC guidance. It provides a good blueprint. Just like Marina was saying, there is a ton of resources and links there that the CDC has provided. They've really done a phenomenal job on it. Some of the big changes before with the May 28th update is the section around promoting vaccination, around really thinking through whether the camp has a vaccinated population or not vaccinated. Remember, even one child or one staff member not being vaccinated equals your camp program not being vaccinated. So we need to really make sure that we're balancing that. I would strongly recommend all programs go under the guidance that there is someone, whether a camper, student, or family member coming into the program space to pick up and drop off, that they should be viewing themselves really as most likely a non-vaccinated program. And because of that, there are some differences between the two. We're going to focus predominantly right now, though, on programs that are non-vaccinated. So on here again, tons of information. I'm going to apologize for the screen scroll, but I want to go right to where it's showing for us to kind of look at. Again, there's guidance if everyone is fully vaccinated. This is an area, though, with our current vaccination rates in state, I think that's probably fairly a small chance that there would be a fully vaccinated program. Again, one youth or one adult would not make your program no longer fully vaccinated. And remember, only kids 12 and up can be vaccinated at that point. We know many of you are working with kids in elementary school age, but there are some different guidance, and it's good for us to look towards into the future where hopefully by next summer we'll see a higher vaccination rate. So the main part that you're looking at is under section number 4 on the guidance, where camps are not, where everyone is not fully vaccinated. And some of the important parts that we wanted to highlight for you is around mask wearing. I know Jessica and a few other folks put that into the comment box. We are strongly encouraging wearing masks. We know the best way that we can prevent the spread of COVID-19 is by vaccinating and increasing our community vaccination rate. And the next thing, one of the things we can do is the use of personal protective equipment, including the use of a face mask or face shield, ideally a mask, especially for youth that are below the age of 12 because they cannot be vaccinated yet. We want to ensure that we're keeping our kids safe. Inside of the guidance, some of the key things for the guidance to notice is about the idea of use of masks indoors. We are strongly encouraging, again, still the use of masks for folks indoors. We know even if staff are vaccinated, that we want to show and lead by example. Good youth development says we are leading by example. You will have less challenges with students about wearing a mask and wearing a mask properly if your staff are also wearing masks and wearing the mask properly. Outdoors in general, people do not need to wear masks. However, we are really being cognitive of what is your local condition. As we saw, as Dr. McLaughlin showed, down in the southeast, down in the kind of Ketchikan region, they're having a higher outbreak region. That might be consideration time to have masks back on unless we can maintain distancing. Also for us to look at as well, some of the considerations with outdoors, say if it is just your students at your camp and they're in an outdoor activity, that might be appropriate. If it's close contact, you may want to put on masks. Or if you're going out into the community on a field trip. We know a lot of your programs do day trips out either on hiking trails or to local festivals and other science centers and other community or cultural events. We want to, again, ensure the students are being safe and masked up when appropriate. And we're going to allow really you and your local community to address that. But we're strongly advising mask wearing still for programs, both for vaccinated adults and non, because what we are really trying to show, all non-vaccinated adults should be wearing a mask. For vaccinated adults, we're role modeling for kids on appropriate ways to wear their masks. It gives the guidance again on the populations that may not be able to wear a mask. Again, we're doing this thinking of we're all in this together. We want to ensure that especially students with disabilities are not being pushed out of camp programs this summer because of concerns around COVID or mask wearing for themselves. The other key area that I wanted to kind of show as well is around physical distancing. This is one where we did see a change in some of the guidances from previous editions. This was part of the, I believe, April guidance one, but we're encouraging at least 3 feet apart between campers inside of a cohort. Again, a cohort is that group of kids that ideally we're keeping together throughout the day and week session or month session. Kids that are outside of the cohort, they should be maintaining 6 feet distance. When we're eating or drinking or doing other activities at exertion, again, we want to increase that distance among our staff and our campers. The guidance for overnight camp, we are thrilled to see so many overnight camps that are coming back online this summer. Kudos to you for toughing it out. We know it was incredibly difficult to have a lost season of revenue and a lost season of engagement for your staff and for your programs. Overnight camps, again, we're encouraging really that thoughtful guidance around what should we do before kids get to camp, what should we be doing during camp, and what should we be doing after camp. Before kids come to camp, we're encouraging everyone 12 and over to get vaccinated. We should be encouraging our staff and our kid populations. Just like they said at the beginning of the call, there is that lag time between vaccination, between being fully, the antibodies fully being in. So we want to encourage that 2-week span as well to help families know and plan accordingly to sending their kids to camp. During camp, before camp, we should also be doing a screening when kids are arriving to the center to make sure that they're set and checking in with families. And then during camp, we're encouraging that daily screening by that staff member. Just again, checking in to see, are there any signs and symptoms so we can isolate appropriately as need be. I'm going to encourage you, read through the guidance. There's lots of really great information here. CDC has really done a phenomenal job. Some of the other questions we've routinely been coming up to and having providers ask us is around when is an appropriate time to test staff who may show a symptom. We're encouraging if the staff members are fully vaccinated, and we know many programs we're doing regular testing weekly or a bi-weekly session. Staff that are not vaccinated, if they're non-symptomatic, do not need to be getting tested. We're encouraging though, anyone who is showing signs or symptoms of COVID-19, even if they have been vaccinated, they should still go out and get a test and reduce contact inside of the camp program until they're clear of a negative test. Again, we want to always err on the side of caution, especially when we're working with children who may be in a part of that non-vaccinated population. I'm going to stop there. We're encourage you to look more into the guidance. We as the After School Network, we're here as your resource to help you navigate all this. That we know there is a lot. But what I would like to do is turn it over to Vicki Longleather, who is with the Trailside Discovery Camp program located here in Anchorage and South Central area. And she's going to share some of the ways that they've been mitigating against COVID and some of the ways that they've adapted and changed their policy on mask wearing and talking to families about COVID-19. Vicki, I'll turn it to you.
Thanks, Thomas. Hi everyone, I'm Vicki Longleather, she, her pronouns, and I'm the camp director of Trailside Discovery Camp. So quick brief information about Trailside. We're a program of the Alaska Center Education Fund, and pre-pandemic, we had our main site at Campbell Creek Science Center and a small site out at Spring Creek Farm in Palmer. But when the pandemic hit, we had to pivot our program to help support the community and fill that childcare gap. So we launched a modified summer program in 2020 for smaller groups and an in-depth COVID mitigation plan, while simultaneously we ran a kit program that was delivered over 100 virtual kits per week to families in Anchorage to kind of help families choose their comfortability level of what they wanted to do last summer. So the pandemic really did create an opportunity for Trailside to step up and expand our programming. So instead of running a typical 12-week program, last year we launched a 16-week program followed by some winter programming. Throughout this whole time, I was educating myself on COVID mitigation and using guidance all around us and other camps as a resource. So currently, right now, we have 5 smaller site locations, and 90% of our programming is outside. And at 2 of our sites, 100% of programming is outside. So we followed CDC guidance, the American Camp Association, Camp Field Guide, state mandates, and we also hired a camp consultant, Dr. Deborah Gilboa, to help guide us through best practices. And 2020 and 2021, we definitely had our kinks, much like all of us, and we're kind of moving through. So recently we did update our mask policy, and what we did is we took parental feedback. We had a few parents reaching out to us saying that if we didn't update our mask policy, would they cancel, would they not? And we just didn't know where parents were at. So from everyone that we surveyed, 5% of parents said they would cancel if we changed our mask policy, and the mask policy change would be where masks were optional. And then when we did this, no parents have cancelled thus far. So starting last week, we changed our mask policy that mask wearing for campers is optional when outside, and it's informed by parental preference during our health screenings in the morning, unless campers are in proximity to members of the public or other groups, or during times where the staff members feel like it's necessary that we wear masks. Masks are required for all campers and staff when inside buildings, and mask is required for staff who are unvaccinated. Trailside currently has 1 out of our 80 staff who are unvaccinated due to health reasons. We also are encouraging staff to be supportive of campers who choose to wear a mask based on the parental preference. And we're educating our staff to try and maintain most of our programming outdoors and within their cohorts. Feedback that we got from this from parents was they were on board our policy. A lot of parents agree with it and actually really liked the way that we went forward and through it. Last week was the first week that it went through, and we found that probably about 40% of our parents let their camper choose, and the rest asked them not to wear a mask and didn't have it. All of our campers do have a mask on them at all times, just in case we do interact with another group, like they're walking past them, or they're on the trails, or they're out and about the wonderful Alaska that we have. We also made sure we decreased our cohort sizes, still within ratio, but we decreased the amount of campers that are in there. So our max group per site is between 10 to 12 campers. And we keep these campers or pods in the same group for the whole time. We established our case contracting and contact tracing so that when we had a case, we were prepared. And we made sure that we educated everyone to say when we have a case. So we're always ready for that. Currently, so far, since COVID started, we haven't had a case of COVID, but when we do, we are ready and we have a plan in place. Trailside is also promoting the vaccine. Currently, from the data that we have, 66% of our campers who are eligible to be vaccinated are vaccinated. And we also have a pool of parents who are really looking for us to send them information on how to get vaccinated. And we're encouraging that. Other than that, a lot of the comments that Thomas said are very similar in what we're doing, following the CDC guidance and as a childcare educator and provider, I think that this group is a huge collaboration tool. Using the American Camp Association, Campfire, and other camps in town coming together, we've had a few discussions about what we do next. So we'd love for everyone to reach out. Always here to talk it through, and I hope that everyone's having a wonderful summer. And I'll pass it back to Thomas.
Great, thank you, Vicki, so much for sharing. And we have had a few questions in the chat too that we'll bring up to the experts. So in regards to mask wearing, so I think Vicki really kind of shared a great example of a program that has been kind of adapting their mask program. And we know guidance is constantly changing, and we want to make sure that we're being responsive to that guidance. So in Vicki's case, again, it's that having a real open conversation with both staff, campers, and the families around your mask guidance policy. Again, a program that is outside, you know, as CDC guidance says, there's reduced risk as long as we're also still maintaining those kind of cohorts and social distancing. And what we are going to encourage, again, though, is whenever there is that kind of mixing of kids, mixing of, you know, special guests coming in or going on a field trip or other circumstances that may cause for it, that mask wearing is still there. I think Vicki really nailed it on the head to say, you know, it's about that conversation with the family about what they're comfortable with. What we want to make sure that we're doing is we're not pushing kids out from programs. We know on the opposite side, though, there are a lot of families who see mask wearing as you know, an infringement or a challenge for them. We don't want to get into the political debate. We want to talk about the well-being and safety of our kids and really frame it in regards to how we can best support kids. There was a question, I'm not sure, Coleman, maybe if you can answer. I'm not sure if Barb or Joe are on the line either, but there was a question in regards to Anchorage and being in that kind of medium level right now, risk level. Where does that fit in regards to mask wearing?
I know, I mean, we touched on this earlier, but I mean, the CDC guidance is very clear that unvaccinated individuals are still advised to wear masks. You know, and it's very clear in that guidance, so I encourage everyone to look at that. But, you know, as our vaccine rates go up and our cases go down, obviously that's a good thing for everyone. I don't know if I answered that or if anyone else has anything to add.
So my name is Liz Olson. I'm a staff physician with State Public Health, and I work a lot with schools. So really similar discussions to what you all are having right now. So, you know, what CDC is really saying here is that once we've sort of gotten past the vaccinated, unvaccinated camp, recognizing that, you know, the vast majority of our camps are going to have one or more unvaccinated people attending, then we're thinking about indoors versus outdoors, and just recognizing that indoors is much, much higher risk for transmission than outdoors. So for unvaccinated camps, you know, CDC is really saying masking is critical in that indoor situation. And then in outdoors, you know, CDC is really saying it's a good idea, particularly in substantial and high boroughs and counties. So I post a link in the chat where you can see the system that CDC uses. It's color coded. It's a little bit different than the system we use on the state website. But it's easy to see, you know, right exactly where those case rates are. So for example, Anchorage right now is in the yellow and moderate. So below substantial and high, where CDC is saying, you know, it's still a good idea to consider wearing masks outside, especially anytime anybody's going to be in close proximity to others, but that this is especially critical with case rates a little higher than they are right now in Anchorage. Hopefully that helps.
You know, the other thing I'll mention around this is, and this is really getting discussed a lot on the national calls, that, you know, around the country, we saw very little in-school transmission. And really what personally, I think, and a lot of the reasons for that is we had universal masking, you know, and I think masks from a science and data standpoint, you know, early on, there were some reasons why we were a little bit unsure. You know, masks were a scarce resource. We were afraid that we weren't going to have enough for healthcare providers. really, the longer the pandemic goes on, we have great data to say now that masks are highly effective to prevent transmission. And like I said, we're handling a lot of the national calls, and Dr. Olson just touched on this, that masking really helped us not have a lot of in-school transmission around the country.
And I am seeing a question here in the chat about, what do we do if we have that situation where somebody came to camp and they might have had COVID and not know it, and we end up not knowing for sure because they don't get a test. So then you're in a situation where some of the campers might have been around somebody with COVID, and we're not going to be able to find out whether that person has COVID or not. So in addition to, what was suggested in the chat here about making sure that a kid with symptoms goes home, that's where we're really going to rely on those mitigation strategies that we have in place. So, the primary purpose of masking is to minimize risk, even in that situation that somebody comes to camp with COVID and doesn't know it. So if you're in a situation where everyone is masking reliably, consistently, universally indoors, and they're, either there's high quality masking also happening out of doors, or there's good cohorting and you're in a lower case rate county, that's going to be, where you're going to be able to rely a little bit more on your mitigation strategies. So, recognizing that not every kid is going to get tested when they go home, they may choose to stay out for 10 days instead. But, here with schools, what we do is it's not just home until your symptoms get better. It's home for 10 days, which is the full isolation period, unless they're testing negative for COVID, just to make sure that folks aren't coming back if they have COVID symptoms. But for everybody else, when this happens in school, we're not closing down schools. We are having folks wash their hands, maybe wipe down surfaces, but we're really relying on masking to be, one of our primary, tools to make sure that folks aren't giving COVID to each other.
And what I will chime into is in regards to that idea. I did see a question around the idea around cohorting in that. That is one of the pieces that's, again, it's one of the mitigation strategies we can choose. So that way, if there is a child who's symptomatic, we don't know whether or not that child is positive or not, and that child leaves program, we're able to, again, monitor that group opposed to having the campers kind of intersperse and mix between groups. At that point, it makes it much more difficult. That was part of the success of schools as well, was schools very much locked on in the classroom. So they were able, once there was a positive case or symptomatic case, we were able to kind of isolate a classroom opposed to having to shut the entire school down. So those were some of the lessons that we learned definitely this past year through the pandemic. There's a question around soccer scrimmages and wearing masks. We are encouraging sports programs. Again, you should be, if the program is not vaccinated, which a lot of youth sports are not, we should again be following those recommendations around cohorting and around mask wearing so that we're reducing spread, because again, soccer and other sports are can be a close contact proximity. We want to do whatever we can to reduce that spread among young people. Definitely one of the critical things as camp facilitators, we want to keep track of which kids are where and which staff during the course of the day. So again, if an outbreak does occur, we're able to kind of minimize the impact to the program and to the children and families by tracking to know who is where. In terms of cohorting, the question was in the box. Again, we're encouraging cohorting to keep happening. It's one of our ways, again, of limiting the spread of COVID. There are lots of fun ways that you can still engage as a full camp or a full youth program or a full soccer program or baseball program, but maintaining cohorting and doing so in a way that's either in your kind of outdoor space and gymnasium spaces and things like that that are larger, that have better ventilation, to be able to still engage as a full camp population, but not intermixing campers together. I'm going to ask, because we are, but we got about 10 minutes left in our call. We asked Monica with the Rasmussen Foundation to join the call today to be able to share about their camp initiative. They have funding that's available to programs right now to help support summer camps. And I'm going to go ahead and turn it over to Monica.
Thanks, Thomas. Good afternoon, everybody. My name is Monica Garcia Ichuak. I am a program officer with the Rasmussen Foundation. And as most of you already know, we had an overwhelming response to funding during the first round. Over 66 organizations across the state of Alaska applied for camp funding to get the kids back into camps and to sort of launch some normalcy over this next year. We had $1.5 million in requests. And it really evolved into a collaborative partnership with the municipality of Anchorage, the state of Alaska, and the Alaska Communities Foundation with Rasmussen Foundation. Rasmussen Foundation actually did not have the capacity to manage all of the different requests, and so we partnered with the Alaska Community Foundation to really be the administrator of the funding. And what has evolved since the first round of funding is a second round of funding. And that camp organization should really know about, which is we opened a second round of funding on June 3rd, which will close on June 22nd. So another 2-week funding cycle. That application and those guidelines are very similar to the ones that we evaluated and had the criteria set at Rasmussen Foundation. It's anywhere from $15,000 per campsite up to $45,000 up to 3 campsites. So it's $15,000 per campsite, meaning that it's not program specific. And you only need to fill out 1 application for the organization. So we just really want to get the word out. It is definitely a much smaller pool of granting that we have available for this round, but we are encouraging all organizations to apply through the Alaska Community Foundation grant portal. I will put that in the chat bar. And I know we don't have a whole lot of time, but you know, if you do want to contact myself and or the Community Foundation, I am working with a couple of colleagues over there that can answer questions. So we just really wanted to thank everybody for pulling together the opportunity to get kiddos back into camps, to getting them outside, just to getting back to some type of normalcy in our world. We know it's been a very difficult year for organizations to navigate. And safety is definitely the priority here. So I appreciate everybody's previous comments about all the CDC compliance. And so, you know, Thomas, I'll kick it back to you. I know we don't have a whole lot of time, but I'm open to specific questions as well.
Great, and if anyone has comments for Monica, you're welcome to put those in the chat box or share those out. A few of the kind of other resources we did want to share with you as well as collective. For us as an after-school network who does advocacy on behalf of all of you, putting in those requests is important. That allows us to see the need inside of the state, and we've been able to really advocate and leverage that need request. With Rasmussen funding dollars and just kind of noticing a lot of the programs that I see here that are in attendance of the call, this is one we've been using the term summer camp, and I should have defined that earlier. We are talking about tribal youth programs. We're talking about culture camps. We're talking about faith-based programs, residential camps, day camps, youth programs, anything occurring during the summertime. So we're encouraging you to seek that support and guidance. We as a network are here. The state of Alaska has been a great partner for our providers as well. Rasmussen and the Community Foundation has really stepped up and really helped feel the need that for funding in regards to, we heard from you all last year, the kind of dire fiscal strains you were in and still wanting to engage those families that needed both care and engagement. So now is our chance to really accelerate student recovery and accelerate student learning going into throughout the summer, going into next school year. There are a couple other things that I wanted to just flag for folks as well. I'm gonna put in the chat box. We partnered with our 50-state network. There is a summer activity guide. There are 140 free after school and summer activities for you to do and use. They're simple, low-tech solutions for you to do with kids. We also put in a learning about COVID-19 activity guide that is broken for kids from kindergarten through 12th grade into cohorts that are 40 activities to teach kids about the science behind COVID-19 So we know there's a lot of information, but a lot of times kids have just heard what's been in the news around them and not being actually taught about it. So we'll share that as well. And we're encouraging you, if you haven't signed up for our newsletter. I did see though, Lisa, is on the call, and Lisa is doing a lot of support programs and guidance around how to safely encourage mask wearing and participation in it. Lisa, are you able to chime in on the question we had earlier about sports and mask wearing?
That might have been for me, Lisa. Please feel free to jump in. You know, I'm working with schools around this as well, and one of the things that we've seen with schools is that when we have cases on one team, we rarely have cases on the opposing team. However, we do have cases on the same team. What that tells us is that kids don't typically, give COVID to each other while they're playing sports. It's more likely that COVID gets past each other on the sidelines, or, when you're in a huddle or drinks are shared or food is shared. So when we're thinking about, high risk activities around sports and around outdoor activities, it's really more when kids are standing around or eating than playing sports against each other. So this kind of comes up against, some of the questions about dry masks and outdoor activities in the rain. We do want kids in dry masks. And so if it's raining and you're outside, it's a good time to put a little bit of distance in between you, but we don't want kids wearing wet masks. Good thing to encourage kids to make sure to come to camp every day with a supply of extra dry masks for exactly that situation. But, if you're having kids run around a lot where, just through exertion, they're going to wet their masks, that's probably a good time to either, make sure that they're putting on dry masks afterwards, or to be not masking during the most vigorous activity and then making sure they get their masks on again when they're standing next to each other afterwards.
And this is Lisa. The only other thing I would add is, and Liz kind of mentioned this, it's really that transition time that can be the most dangerous, going from one activity to the next, or right before camp starts and right after it ends, where people kind of let down their guard. So having some, dialogue with parents on what the expectations are before and after camp, I think would be very helpful also.
Great. Well, thank you to all of our experts from the state who joined us, from the municipality who joined us, from the Rasmussen Foundation who joined us as well. Really appreciate your partnership. Again, we are all in this together. We're going to hold the call open for a couple extra minutes if there are more comments and questions. Again, I'm going to encourage you, if you're not already signed up for our newsletter, this is me doing a shameless plug, but this is also an opportunity for you to get connected to resources. We are going to be posting, there are several other funding sources that are coming out right now, not COVID related. We have some STEM grant funding. There is funding around service learning and other opportunities. So we're encouraging you, get connected to the network if you're not already. This is a great opportunity for you to hear from your peers and work across the state. With that, again, just want to commend you all for the tremendous work you've been doing last summer, this summer, and into the future on keeping our kids engaged, safe, healthy, and really re-inspiring learning and growth for our young people. This has been a super hard year, but we've been in this together as a network together, and just want to say we are still here for any support and guidance. If you're not sure on something, feel free to reach out to us. That is our resource as a state to provide free technical assistance to after school and summer programs. So feel free to reach out to us. We're happy to help, however. And Marina, do you have anything else you'd like to share before we close?
Oh, no, thank you so much for joining the call, and please contact us directly and we can be happy to answer questions as well. We can be available when you have questions. And I don't know, I think the time is kind of ending. I have one more question. Can you describe the difference between emergency use vaccine versus typical FDA approval vaccine? If somebody want to get an answer to that one, it's what I see.
Yeah, I can give a quick explanation. So it's important, there's a lot of misinformation on the internet about this. So it's important to remember that here in the US, our drug approval process is the safest, it's the most rigorous, and it's the most stringent in the world. And it's based on two pillars. that drugs that get approved are safe and that they're effective. So vaccines are drugs, just like many of the other drugs we take, they're considered drugs by the FDA. So the emergency use pathway, it enables drugs in an urgent situation like this to go through the line faster. So they don't skip any steps. They still study it in the same number of people. They still look at the same safety profiles. They still want to make sure it works. Some of the processes are done in parallel. The other thing that it really allows for is under typical approval, the FDA, who don't run drug studies, the FDA analyze data, won't look at the data until all of the trials are done. So in the instance, like say these vaccines, for example, where we've had the adult trials done for 6 months now, and the trials are still ongoing on kids, under the typical process, the FDA would not have looked at the data on adults. They would have waited until everything was done and looked at everything at the end. So typically full FDA approval isn't granted until all ongoing trials are done. Now that being said, if these vaccines were only being studied in adults, those trials are done, we would have full FDA approval now. There's no reason to believe it wouldn't happen. Same way if it was only being studied in 12 and up. So just want to encourage everyone that, no corners are cut, nothing is skipped. It's the same process. It's just a little bit different terminology for the FDA to allow things to get done quicker. Basically, I say, you get the fast pass and you skip all the lines because really drugs, you spend a lot of time waiting on the FDA to tell you what to do next. Years of drug trials can spend just waiting in line.
Great, thank you so much, Coleman. Other thing I am gonna just remind folks again, if your program, your organization, or your community would like to host a vaccination clinic, please, please, please reach out to us in the state and or the municipality, and we will help ensure that that happens, because we know with school letting out basically the week that it was approved for 12 and up, we missed that opportunity. We want to get kids vaccinated to reduce community spread and get them ready for a great summer and a good start to the school year. Any other questions before we finish? Feel free to take yourself off mute too.
Now, please remind them to take regular vaccine besides the COVID vaccine for children, because they're really behind on that at this point, and get ready for the new school year. That will be a great idea. Thank you, everyone.
Great. Thank you, everyone. Stay well, and we'll see you soon.
Thank you. I think it's great.
Super, thank you.
Yeah, I had a lot of good questions, good answers. It's wonderful. It's really enjoyable and informative.
Yeah, I dove in a bit more on and you can stop recording if you'd like. So I can